We're going to be getting started in just a second here. Thank you, everybody who's patiently waiting.
Okay, I think we'll go ahead and get started. All right, hi everyone. Thank you for joining us today for our webinar presented by UWorld Medical and Elite Medical Prep. My name is Kelly Chopra, and I am the Business Director for Medical Sales at UWorld. Most of you are probably familiar with UWorld, but we wanted to borrow a few moments of your time today to help you understand how to best utilize our question bank, both in and outside of the classroom. I will walk you through both a study outline as well as take you on a tour of the UWorld Step 1 question bank. But before I do this, Elite Medical Prep will be speaking with you today about how to get the most out of your studies using longer and a more strategic approach to the UWorld question bank. Elite Medical Prep is an organization that specializes in tutoring medical students for both the USMLE and COMLEX, as well as shelf exam. They have worked with thousands of medical students at schools throughout the US, Caribbean, and many other foreign countries. Today, we are lucky enough to have Dr. Marcel Bruce Raymer, the president of Elite Medical Prep, alongside of Dr. Ken Rubin, the CEO and co-founder, both representing Elite Medical Prep. After both presentations, we will open up the webinar to questions and answers. Should you have any questions during the presentation, please utilize the Q&A function at the bottom of your screen, and we will work through all of these questions to ensure that no questions go unanswered. I believe that we have an example of this for you now. Again, at the bottom of your screen, you'll see a little Q&A icon that you can click on. And throughout the presentation, feel free to go in and fill out your questions so you don't forget them at the end of the presentation, but we will actually go through and answer them throughout the at the very end of the webinar. Again, we're so excited for all of you to join us today. Without further ado, here's Marcel Bruce Raymer from Elite Medical Prep to kick off the webinar.
Kelly, thank you for inviting us to join UWorld today. As Kelly mentioned, my name is Marcel Bruce Raymer, and I helped found Elite Medical Prep. It's an organization that specializes in tutoring for the COMLEX and USMLE, as well as the shelf exams. We also have tutoring services for the MCAT and for post-residency board certification in several specialties. I'm also very happy to have with me my colleague and co-founder of Elite Medical Prep, Dr. Ken Rubin, and he's the course director for USMLE Step 1 and Step 2 courses at Mount Sinai. Our team the team of the Elite Medical Prep is comprised of highly trained MD and MD candidates from top medical institutions. We've worked with many thousands of students at schools across the US and throughout the Caribbean and other foreign countries, as mentioned. We've developed many strong institutional partnerships, including at Mount Sinai and UNLV, and we provide official USMLE courses for students at those schools. Can we go to the next slide, please? So I wanted to have a brief discussion about some learning resources that many of you use when you're preparing for the USMLE exams and also for medical school. At Elite Medical Prep, we emphasize an active learning style. If we go back to the previous slide with the triangle. Oh, great. So here we've organized the major types of learning resources into a pyramid, from more active resources at the base to less active resources near the top. Active learning resources such as question banks and the review are really the foundation of learning. Flashcards, which are now integrated into UWorld, are similarly an active learning resource, and those should be emphasized over less active resources. Conversely, less active resources, which are near the top of the pyramid, should be used more sparingly because we've shown that and we've seen that they're less efficient for review and preparing for test day. So when you consider this is some quite different from sort of the traditional way that we were taught to learn, where traditionally we were emphasizing repeatedly reading something and then only trying to do practice questions. You can go to the next slide. Okay. So here, I think Dr. Rubin, are you going to take us through this slide for us?
Sure.
Some background data. Go ahead.
Yeah, absolutely. Hopefully you guys, can you guys hear me?
Yeah.
Okay, great. So first of all, thank you, Dr. Raymer, and thank you, Kelly and UWorld, for this opportunity. So looking at the slide, the key is to start early with active learning techniques. Why is that important? Well, it helps with stress management if you regularly include QBank use in your daily and weekly routine. You want to start using the QBank so that you have lots of time to comfortably complete the entire QBank at least 2 times through. And if not a full 2 times, a modified second pass, as we'll talk about in subsequent slides. In an experiment with medical residents, the researchers found that regular testing rather than reading solely led to a significant increase in knowledge retention 6 months after the initial teaching session. And it's hard to see on the graph here, but at 39% versus 26%, difference in knowledge increase with a p-value of less than 0.001. So that's quite significant. With studying alone, however, the rate of forgetting is rapid when mastering new material. You can see here it's 74% of material is forgotten at 6 months. However, active question use significantly decreases this forgetting effect. The bottom line here is that if you're going to spend time studying early in med school, you will forget significantly more by passive studying alone compared to studying that includes active use of a QBank such as UWorld. And we can go to the next slide.
And I'll take this one here. So yeah, so as Dr. Rubin pointed out from the evidence, it's definitely very important to use question-based and active learning. And it's important to think about the right frame of mind when considering why we as medical schools are taking all these standardized exams. For many of you, many of us, we can think of it as just something we need to get through. It's a barrier, and it's a hindrance to our getting to the end of our medical training. However, we can also think of these tests and preparation as opportunities to prepare ourselves for the challenges that lie ahead, both in medical school and in our training and as clinicians. And what ultimately makes one a true professional is a commitment to continuously improve and prepare. So testing oneself is really the most efficient way to do that and improve that learning. We can go to the next slide. So we've talked briefly about why longitudinal use of QBanks are important and we've shown you some of the evidence, but I wanted to briefly suggest some tips on how to actually do that. I recommend most of my students try to start their day with, say, a mini block of questions. This can be in tutor mode with as few as 3 to 5 questions. It kind of gets your brain going, and it sets a good habit of taking and reviewing questions on a daily basis. You can try to do review questions that are related to the topic of an upcoming lecture in medical school. So this will help you focus on the points in the lecture where you're weakest and where you should concentrate most during that maybe 1.5 hour lecture. Many of our tutors recommend that their tutors pick 1 day per week to retake and review all the questions they got wrong earlier in the week. This is a great opportunity to look for patterns in your mistakes and for connections between different organ systems and different subject areas. We can go to the next slide. So here I'm going to just start us off, and then Dr. Rubin will take us through. So here we're showing a practice question breakdown, and we've talked about why to use questions and how to incorporate them. But I also want to actually show you how to actually extract information from the QBank questions themselves. And here we have one of our challenge questions that we use in tutoring. Let's look at this one question and see what it can teach us more than just the topic of the correct answer. In prior presentations with UWorld, we've used this exact same question to demonstrate our 4-step approach to USMLE questions. That 4-step approach briefly is that we typically read the last line of the vignette first, then we review the answer choices, then we break down the vignette before we're using process of elimination to help choose an answer. But today we're going to use this question differently and skip to the review of the answers to this question. So if we can go to the next slide, and maybe Dr. Rubin, you can take us through this. Ken, do you want to take us through this part of the?
Why don't you walk us through, and then when we get to some of the question breakdown, I will take over.
Perfect. That sounds great. So I'm going to help walk you guys through this question, and in order to walk you through this question in a sort of a little bit more efficient way, I just highlighted some key points in this patient case. So here we have a case where we have a middle-aged man. We have an acute onset of bloody diarrhea. There are signs of cirrhosis and liver failure. There are also signs of shock, and the patient is afebrile. We know that the pathology involves small bowel and likely has an ischemic hemorrhagic cause. So we can go to the next slide, please. So I'll briefly jump to the right answer, and then we'll sort of see what we can extract as far regarding the other answer choices. So the correct answer in this challenge question is mesenteric venous thrombosis, and all the clues that I pointed to in the previous slide point to this diagnosis. That includes the age, the bloody diarrhea, the involvement of the small bowel, and the lack of signs of infection. However, I think we can get a little bit more out of this. So we go to the next slide. So before leaving this question, and before leaving any question you do in a UWorld QBank, we can evaluate more closely and see what we can learn from the wrong answers in this vignette, and we can categorize them into different answer types, and then we can come up with different one-liners for each of these disease processes. And finally, we can make a strategy of how to learn those pieces of information that we had learned in the past but forgotten, or maybe we'd never encountered before. So now I'm going to pass it off to Dr. Rubin, and he'll kind of give us some of the tips of how we can do that. So we can go to the next slide, please.
Absolutely. So here we've shaded the etiologies that are infectious in pink. what we can see here is that there are three answer choices highlighted: C, E, and H. While all of these are infectious etiologies, they each have important associations that you should be aware of for USMLE purposes. In particular, pseudomembranous colitis and bacterial enteritis are commonly tested entities, and we should make sure that we are very familiar with them. For example, we should know that pseudomembranous colitis is a diffuse colitis that is caused by C. difficile and usually presents several days to weeks after exposure to antibiotics. It is characterized by the presence of grayish pseudomembranes in the stool and often requires treatment with metronidazole and vancomycin, although there are some newer antibiotics that you may also want to be familiar with. Bacterial enteritis is another common process that typically refers to infection in the small bowel with bacteria such as E. coli, Salmonella, and Campylobacter. You may remember a class of hemorrhagic, causing hemorrhagic colitis, which is going to be seen with blood in the stool. Sometimes the symptoms that we see are caused by the bacteria themselves, but other times the symptoms are caused by the toxins they release. Finally, Whipple disease is a much rarer entity, but has a classic association of chronic diarrhea, malabsorption, joint pain, and swelling. And although a rare entity, it is tested on USMLE, and so you need to be aware of it. All of these wrong answers can be learned and should be learned with flashcards. We can go to the next slide.
Okay. So, Ken, I think I'll take this one then. Go to the
Sure,
next
go
slide,
ahead.
which is in blue. Okay, great. So similar to what we did on the last slide, we can do the same thing here with the two answer choices that I've chosen based on anatomic location. So here I've shaded in blue etiologies that only involve the colon, but not the small bowel. So we have here answer choices B and C. So ulcerative colitis and pseudomembranous colitis. So as you can see, the names mentioned just the colon. We can use the anatomic distribution to remind ourselves of the anatomy of the GI tract, how certain processes only affect one part of it. For example, we can recall that ulcerative colitis does not involve the small intestine except the terminal ileum, and that only occurs after it's affected the entire colon. So don't confuse ulcerative colitis with Crohn's disease, which can involve any part of the GI tract from the mouth to anus. In the interest of time, we're going to move on with our discussion, but I want to remind you that this process can be done with every question, especially as you review your answers to questions you've taken in the UWorld QBank. We can go to the next slide. Okay, great. So in this slide here, we're showing the typical breakdown that you see that occurs after you're using the UWorld QBank, and this gives you a percentage right and percentage wrong. And what we see here is what we're showing here is maybe a typical presentation of what might happen after you go through your first pass through the QBank. As Dr. Rubin mentioned earlier, we recommend that students try to aim to go through the QBank at least 2 times through, or if not, at least a modified second pass. The idea, though, is that you should be thinking about your first pass as the learning phase. You're going to probably have a high ratio of incorrect to correct answers. You shouldn't be afraid of the challenge. You shouldn't also be worried about the issue of running out of questions and do something what we've seen is called saving questions. You should try to complete this entire QBank at maybe a slower pace. Maybe that takes you 3 to 4 or 5 to 6 months to finish it. If we go to the next slide, please. So here we're showing maybe a statistical breakdown that might be more compatible with somebody going through a second pass. And this is something we can refer to as the consolidation phase. And in this phase, we're taking the questions probably more in a timed method. And the idea here is we're trying to solidify our knowledge, also to practice for test day with timed practice. So here you're going to be seeing significant improvement in your correct to incorrect ratio. And in this case, since you've already done a first pass, you're going to be doing this much faster. In something about 2 months or maybe even less, maybe as short as 4 weeks. And these two passes have great effectiveness in learning and it's consolidating the material.
And Dr. Rushamer, can I just say one thing here?
Sure, please.
So, a key point for you guys out there, first pass versus second pass. First pass is about learning content, so learning from the depth of the explanations and the supporting figures and charts of the QBank. Second pass is really about test taking, working on your speed, your pacing, your intra-block performance. Neither pass is strictly about percent correct. Yes, your percent correct should go up on your second pass. You've seen the questions before and now you're more acclimated, but in neither pass should you really be dwelling excessively on those numbers. You have other assessments for that purpose.
Exactly. So we can go to the next and our last slide before we're going to hand off. Great. So before I pass the virtual baton back to our friends at UWorld, I wanted to briefly point out this chart that sort of describes my thought process on the evolution of sort of medical student learning styles. So when I started medical school, and I've been involved in medical education for over 20 years, there was a time when I started medical school, I remember students said they didn't really use QBank questions at all. They just sat for the USMLE. It's as shocking as that seems, that was the case. And it's kind of like our very old school original telephone. If we go to our rotary phone here, this is the second one. It reminds me of the time when people just used QBanks during their dedicated study period. And I remember distinctly that occurring when I was taking the USMLE. That was the focus. And then progressively we got to a point where students use a QBank regularly, but only after they'd learned the topic. The QBank was a secondary thing after you've done all your reading. But now what we find, and what we find from our tutors and from our top performers, top performing students at schools we work with, is that students who are going to do their best in learning the material and also best on test day are going to be using the QBank daily as a tool to learn new material right away from the beginning of medical school. So there's really no time too early to start getting to using your QBank and extracting the value, the learning value that comes from it. And with that, I'm going to hand over the presentation to Kelly. Thanks so much for your attention.
Perfect. Thank you so much, Marcel. I'm just going to quickly jump over to my presentation really quickly. Perfect. Okay, I am going to spend the next 15 minutes or so walking you guys through study tips and a tour of this Step 1 question bank with UWorld. Okay, so the number one question that we get at UWorld is, how should I study? And we go about this a couple of different ways at UWorld, but our biggest recommendation is that you buy no less than a 360-day subscription. And the reason for that is we have over 3,900 questions in the Step 1 question bank at this time. So to give yourself a real advantage in learning the types of questions, how they're written, and how you can really drill down on each question, you need at least 360 days to work through this bank. So if we allow you guys 6 weeks for dedicated study time, the way to drill down on this is it would essentially leave you with 318 days to get through the QBank prior to dedicated study. That would leave you 45 weeks to get through 3,971 questions. So that would give you 88 questions per week. And so I know that you sit there and you're thinking, gosh, how do I do this and go to class and study through all of that? And really how you should do that is once you go through your subjects and systems in school, you should use this alongside of both of those. And so if you use the system-based approach, you would go through the bank slow and steady. You're going to build your knowledge of foundation. You're going to take one of the self-diagnostics and really see where you are progressing in the question bank. That would get you through the entire question bank with 6 weeks left prior to your test date. Once you get to that dedicated study time, you would flip it and start using a test-based approach. So you would reset your question bank. That would reset everything except for the flashcards in the My Notebook feature, which we'll touch base on here during the presentation. But it would reset all of your data. So you would start working through this for speed and stamina, making sure that you're able to answer all of the questions in 90 seconds or less. You're getting through all the subjects that you're maybe weaker on or struggling in, and really zoning in on how to go through and get to the best end of each block as you work through your dedicated study time. All right, so now we're going to go through and I'm going to give you a quick look at what creating a test looks like. And really how you should go through each question, why the questions are written in the format they are, and how to move forward with your Step 1 QBank. So first you'll notice in the create your test section that you have a couple of choices just to start out. You'll work through choosing whether you want to work through tutor or timed mode. Again, once you're working through this before dedicated, we always suggest tutor mode and utilizing all of the unused questions. Next, you'll go through and you'll choose what subject or all subjects that you want to work through. Again, we really prefer for you to take the systems-based approach and work through it alongside of your studies. Within the systems, you can also actually drill down and choose subcategories. And so this allows you to get more and more specifics as you're working through your classroom notes. All right, last but not least, before creating the actual test itself, you can choose the number of questions that you can utilize per block. We have maxed it out at 40 questions because we are trying at the end of the day to follow MBME outlines on this. All right, so I want to go over a question for you, and we're actually going to go through a couple of them for UWorld. So before we actually get into the content of the question, I want to go over a couple of things that I think are really relevant to how the questions are written. You'll notice that all of our questions are written in clinical vignette form, and this is done for two reasons. You'll see this on the MBME test, and we want to make you feel comfortable when you do eventually get to that point where you're sitting down to take or to test for the exam. But this also reinforces the basic sciences that underlie future patient care. These are scenarios that you're going to see in day-to-day care. Therefore, we wanted to give you the questions written in this format for that reason. This question specifically is a subject of immunology, and the system is pulmonary critical care. In each of the questions, you'll notice that you can go in and use a couple of enhancements. Specifically on this one, I've shown you how you can go in and highlight certain words that are going to help you come to the best conclusion of an answer on this one. Specifically on this question, the answer was B, CD4, T lymphocytes, and macrophages. You'll notice that once you answer the question in tutor mode, it will tell you whether the question was correct or incorrect and how you are doing alongside of all of the rest of the people in the UWorld question bank that are answering this. Next, with the explanations, we always are going to give you written explanations as well as a visual explanation. We have everything from illustrations to high yield table, sometimes radiographic images. This is to ensure that everyone sees the question in the best learning style for them. So those of you who are visual learners, you will get the visual impact, and those of you who are written learners, you will be able to read through it. Through this, you'll also notice that in the review of the first question, we have reused strategic bolding to give you subtle but impactful repetition. Without realizing it, going through each of the questions, you will see it in 3 to 4 different ways on each question. So this just means that you're going to go in and you are going to read the question and the answer in 3 to 4 different ways just to build that repetitive knowledge in your brain. We also do go through each of the incorrect answer choices and why they are incorrect. Last but not least, on each question, you will get an education objective. This is a summary of the main points of the question and answer in 2 to 3 sentences. All right, so we're going to go on to another example of a question that you're going to see in the UWorld question bank. Specifically on this one, we're showing you a CT scan. The subject of this question is pathology, and you would find this one under the system hematology oncology. So specifically on this question, you'll notice that not only do we show you what the PE in the answer of this question looks like, but we've also labeled the other surrounding anatomy for you. In these answer choices specifically, you'll notice that all of the answer options will show you what their CT findings are. So not only are you looking at the CT in the original question and the correct answer for that one, but you're seeing in the incorrect answers why those CT scans would be answered correctly. So moving forward, we wanted to show you a couple of enhancements in the UWorld question bank that you can utilize if you don't have time to actually work through questions. Specifically, our first one that we're going to highlight here for you are the flashcards. So on each of the questions, you have the ability to right click on each of the questions and it will show a lightning bolt. You will click on the lightning bolt and it will come up with a blank flashcard. you can utilize any of the information that is in these questions and answers and put them into a flashcard. From there, you will be able to organize your flashcards into decks, and then you can study them as best use for you. We always recommend using the study decks using spaced repetition, which each time you practice one of the cards, it's going to ask you to rate the card of difficulty. With spaced repetition, you're going to end up seeing the difficult cards more frequently until you've mastered them. And you're going to see the easier flashcards less frequently to challenge your brain to retain the information in the long-term memory. You can customize all of your study decks to whatever categories it is of your choosing. So next, I want to go over the highlight the feature of My Notebook. In both the flashcards and My Notebooks, both of these enhancements should also be able to be utilized within your classroom notes as well. So as you're in the classroom, you can utilize both of these to add more information that you're learning in the classroom and not just stuff that you're learning in the UWorld question bank as well. Specifically in My Notebook, you can create your customized electronic notebook with all high yield information. And you can copy any UWorld visual or written content, as well as any classroom content you can upload into this. And lastly, you can structure the default structure mirroring of the QBank. So you can go through and organize this to how you've worked through the question bank, or if you want to organize it due to your own study preferences, you can do that as well. Next, I want to just go over your reporting and understanding your dashboard. So this is really understanding how you're doing in the UWorld question bank and how you are ranking against other users worldwide. So specifically on this, I know Marcel touched on it in his presentation as well, but this is really how you should determine when you start your dedicated study time, where you should focus. So specifically on these reports, you can drill down by subject, and from there you can take it down to systems. So you can see where you're needing to really focus during that dedicated study time to really enhance those specific systems. You can also go through and look at your previous tests. This would be really important once you get down to right before dedicated. You can go through, see which tests you've really mastered, and anything that you think that you need to spend a little more quality time on during that dedicated study time. All right, so I just wanted to go over and maybe do a quick recap of how should you study now that I've given you that first part before we started the tour and now here. And the best advice that we can give you is to start out slow and steady. Use it in tutor mode, do as many questions as you can, build that foundation of knowledge, use your flashcards and notebook. Don't focus on time, focus on getting through the question bank one full time before you get to dedicated. And once you reach dedicated, really focus on your speed and stamina and try to simulate the exam as many times as you can before you get to that point. And so in recap of all of that, for those of you who do not have a UWorld question bank at this time, after the presentation, in the next 24 to 48 hours, we will send you a follow-up email with a bunch of this information condensed, but also with a redemption code. If you would like to go in and purchase a question bank, you will be able to purchase a new subscription at a discounted rate. But as we promised earlier, first of all, I just wanted to thank you all for joining us. But we're going to go ahead and move to open it up to Q&A. Again, if you would like to answer or ask a question and have us answer it, at the bottom of your screen, you'll see a Q&A box. And so you can go in and click through on that. On behalf of myself and Dr. Bruce Raymer and Dr. Rubin, we want to thank you for joining us and hope that this was an insightful webinar for you.
Okay, great. So we're going to give you guys an opportunity to put in some questions, and we're available here to answer them. You can type them into the Q&A. If you'd also like to raise your hand, and I think you can unmute yourself and speak up, we could do it that way. And we already have a couple of questions. I think we've had one or two questions in the Q&A so far, so it would be we can go ahead and answer them. I see that somebody's already raised their hand amongst the attendees. Let's see where we can find. Okay, and there's somebody by the name of Stephen Chang. I guess yeah. Do you want to go ahead and ask that question, and then we'll get to some of the type questions?
Hi, can you hear me?
Yeah, I can. Go ahead, Stephen.
Okay, great. Cool. So my question is, whenever I do the practice questions, I think I get kind of stuck on how to go about reviewing them. So say I'm doing a practice question and then I get it wrong. From there, I understand that like I should read the explanation for why I got the wrong answer, and then also read the other explanations for the other answers. But then I get stuck on what I should do with that like question next. Should I be like saving that question to go back to review the question later on, or should I be doing flashcards to like kind of solidify that information? I'm just worried that once I finish reading all the explanations for the answers and I move on, I'm gonna kind of like forget that question if I don't go back and see it.
That is a fantastic question. Dr. Rubin, do you want to handle that first?
Yes, yeah, I agree. That's a really good question. One of the benefits of UWorld's expansion of the QBank, and I always say when talking to students that I remember when Step 1 QBank had 2,000 questions, and there was a time when it had less than 2,000. It's grown a lot, and now it's about 4,000 questions. One of the benefits of that is that there's a lot of repetition built into the QBank, and I think that's by design, where a specific teaching point comes up in many different questions. And maybe the question is not exactly the same, but the sorts of explanations that you'll see, especially for the wrong answers, those patterns, that wording, and a lot of the figures, the tables and the graphs and the charts are used in many different questions. And so if you go over a UWorld question, you feel like, wow, this was a really great explanation. This was really useful. I don't want to forget this. Well, that's probably because it's really well put together question and explanation. But beyond making a flashcard from it, which you certainly can, and Kelly talked about that a little bit, and beyond making a few additional notes for yourself or marking it, which you can do, you can mark the most important questions or most high-yield questions for yourself. Don't worry about moving on, because you will likely see those concepts come up again in future questions.
Yeah, okay. I can also give you a quick rule of thumb. So if you see a question where it's, say, and this is where some of the value of the QBank, some of the great value of the QBank comes up. If you see a question where, say, 60, 70, 80% of respondents are getting that question correct, that's one that you definitely want to make sure you're going to make a flashcard, that you're gonna know that and understand it, so that you master that. However, on the other hand, if it's a question where only 20% of people get that right or less, then you know that that's going to be a much harder question, maybe something you can put to the side and not have to focus on as much. So that's sort of a quick rule of thumb.
Okay, cool, great. And one last question then.
Sure.
If I make a flashcard, because I've tried Anki and it hasn't been great. But if I do make a flashcard, how much information am I putting on there? Because I started spiraling and adding too much information to a flashcard, and yeah.
Another great question. So my rule of thumb is, or rule of hand is, there are 5 fingers on your hand, no more than 5 pieces of information. Actually, in fact, try to keep it to three pieces of information, and make sure that those pieces of information are not like long sentences, but they're a sentence fragment or less. So no more than 5. I think that we have 5 fingers, so we can't really memorize more than 5 things at a time. Okay.
Okay. Great.
We have some questions that we're typed in the Q&A. So I want to, Stephen, I'm going to mute you. Okay, I'm going to mute yourself. I'm going to go through some of them. I guess one of the questions that we have here is, exactly how much time should I devote to QBank work each day during med school and during dedicated exam prep? Dr. Rubin, do you want to handle this, or I can take it?
Sure. I don't want to sound glib at all in the answer, but the first thought that comes to mind is as much as you can reasonably accomplish and consistently accomplish. A mistake we see from students is they think they hear this sort of presentation, they're told by their upperclassmates that UWorld is a great QBank, or just doing questions is really useful from day one of med school. And then they want to do questions, but they overload themselves. And they're like, oh, I'm going to do 10 questions a day. I'm going to do 20 questions a day. And it seems reasonable, but it gets totally subsumed in all of the other responsibilities of being a med student. And so if you try to do too many, you can actually be counterproductive, and you might give up entirely. And so what we always recommend is start with a smaller number. Even if it's 5 questions a day, it might be 3 questions a day, especially if we're talking about early in med school. Just start with a small number so that you're constantly testing yourself and not just passively reading. And once you figure out what that number is for you, where you can do these questions every day or whatever your schedule prescribes, then maybe you up it. But better to start with a smaller number and actually accomplish it than try to do too much and then just give up on the whole endeavor.
Yeah, I'll add, if you're thinking about a time commitment, just try to start with a half an hour, just a half an hour on questions if you're early in medical school. Obviously, if it's during dedicated exam prep, I would say at least 50% of your study day every day should be on that. It's a minimum 50% of the time. So if you're going to do 8 hours of studying, at least 4 hours is going to be on question taking and review. If you're going to be doing going for 10 or 12, then you're going to be doing much more. So about 50% or more, minimum 50%. I want to go to another question we have. It says, why are flashcards considered an active learning resource like QBank questions? And I'll just mention that we're going to answer this live. Okay. I'm not sure if well, go ahead and answer. So the flashcards have the same kind of effect as QBank questions, and this is something we've presented on previously with UWorld. They have the effect of a sort of a testing type function, and that has been shown repeatedly throughout the education world, in medical education and other forms of education, as being the most effective way for learning. It's not always the most comfortable sensation to be tested on something and then not get it right, but it is definitely the most efficient and the most effective way to learn things and to retain them long term. So you can think of flashcards as like mini questions. Okay. I guess there's another question here that we have on the list. It says, how should students use UWorld question bank if they start using it only during their dedicated study time? Do you want to take that, Ken, or do you want me to answer? Go ahead and answer.
I can give some thoughts. If you only use it, so I like this question very much, actually, because we talk about, oh, you should be doing UWorld twice, your first pass, your second pass. This is an ideal world, but of course we don't live in an ideal world, and sometimes for whatever reason you weren't able to do that. So okay, you're in your dedicated period. We would recommend the same type of breakdown, except on an accelerated basis, and by that I mean, can you do 8,000 questions in 2 months? That would be 2 full passes, not likely. However, if you still want to follow the structure of first pass, which is mostly systems based and much more about content review and going in depth with the explanations, and then the second pass being more about test taking and time blocks, you just would have to do a percentage of the QBank each time. So maybe you can't do 100% of the QBank on the first pass. Maybe you can only do 40 or 50 or 60% of the questions. Now, it would be great if you could do all of them, but as long as you're getting a sampling across all of the systems, you're getting enough from that first pass to at least make it valuable. So if the question becomes, do I do just 1 pass of everything or still 2 passes, except doing a fixed percentage each time, I would say a fixed percentage is better, because then you can still follow the sequence that we know is going to yield the best learning for you.
Okay, that's definitely, I agree wholeheartedly. I want to get to another question that we have here. It says, what about redoing incorrect questions the next day or every other day after getting it wrong and reviewing it? I think we mentioned during the presentation the idea of doing maybe wrong questions review once a week. That was just a suggestion. The idea here is that reviewing wrong questions you've gotten wrong is a key part of learning. It's not simply, I do the question and I see whether I got it right and I confirm whether I know the information. It's, I do the question, I've gotten it right, and if I've gotten it right, I'm going to consolidate that information and then also learn about the wrong answers. But if I got it wrong, I'm going to try to learn from it and then retake that question. And the key thing I think here is setting up a regular schedule of doing that. Now, if you want to do that on a daily basis, that's fine. If you want to do it on every other day basis, that's fine. Or at a once a week basis, that's fine. But not redoing those wrong questions is sort of losing out on a good chunk of the learning potential that you get from the QBank. This is really the most powerful resource out there for learning. Question banks like UWorld provide the greatest learning benefit in the quickest amount of time. And they, again, as we showed in the evidence from the research, they also help you avoid the process and the problem of forgetting. So just you need to set some kind of regular schedule for redoing those wrong questions.
And Marcel, I would just say
Yeah.
I totally agree with what you're saying. The incorrects are important and they can be done on a more frequent basis every few days, or it can be done once per week. In our EMP scheduling templates that we put out, and those are not for everyone, those are just stylized. It's like the McDonald's burger that looks all juicy, but no one actually gets that, or the Starbucks coffee. But the idea that we encoded in our standard templates is once per week incorrects. I think on incorrect Fridays, you put them on Friday. And the idea is that if you try to do incorrects too frequently, you might end up crowding out the new questions. Just like we've been saying, there are a lot of questions to do and things take a lot longer than maybe we initially think. So if you have longer intervals of incorrect questions, maybe only once per week or twice per week, not only does that allow you to make more progress with the QBank as you're going through it on your first and second passes, but it also actually pushes the incorrects a little farther out, making it a little more strenuous for you to recall the information, making it less likely that you will simply recognize the right answer. And so you get a dual benefit that way. That's why it's our recommendation, but every student is different. I think the key is that you're doing some of these incorrects again on whatever schedule you decide. That as long as you're doing that, then you're on the right track.
Correct. We have another question here. It says, should I also start tutoring early in medical school, or should I also try to just QBanks get started with them early? Do you have any thoughts on that, or do you want me to go?
Yeah, well, so a lot of students that we work with for tutoring are really gearing up towards their board exams, towards step one. And so there's some students who will tutor just during their dedicated, some will tutor throughout second year to really get into it. It's a smaller group of students that tutor during first year. The benefit to that would really be laying a strong foundation and a long-term study plan. So what could make sense for students who are interested in receiving the guidance and the experience that we have to offer would be some limited sessions in the beginning of first year to really kind of go over this big picture stuff that we're trying to get across to you in this type of webinar, and just make sure you're using the right resources, that you have a longitudinal plan, that you're using QBank the right way from the beginning of med school, because we do believe that that's important. And then maybe some check-ins along the way. There are some students who really want that support, and financially they're able to do that, and that's wonderful. But just for practical reasons, typically students who do start in first year, it's going to be more spaced out and not going to be the same sort of intensive schedule that we typically use for students who are working with us during dedicated or in their approximately pre-dedicated period.
Yeah, I'll add one little piece here is that in general, getting started earlier with both QBanks and also if you're going to consider some tutoring to help structure things may be more important than ever. And that's because many medical schools are going to accelerated preclinical curricula. So there's really less time than ever to sort of get through the same information as you did before. So anything that can help you make your studying more efficient and more effective is going to be a good learning tool. And if that includes tutoring, and that's something, a service we offer, that's great. And obviously we think QBanks are definitely great regardless of whether you do tutoring or not. I want to move on to we have a couple more really great questions here. A question that came in from YouTube Live. So just so you know, we have this also presented, and it says this student is an IMG. Said in my medical school, there's 6 years long, and there's a fear that she might be starting too early and that she'll burn out. I can take this question. I think that as we've talked about, starting early does not mean going all in with 100 questions a day. Starting early means using it in slow and steady pace. I think Kelly's slide with the tortoise and the hare is really important. That tortoise phase, that slow phase, can be quite a long period of time. It can be several years in the case of this student, where you're getting used to doing questions on a regular basis. Remember, questions are going to help prime you to learn the information better from your lecture. So doing questions before the lecture is going to help you then absorb the information that's important and the information that you're weaker on. So using questions as a regular part of your learning is going to be a more effective thing. It doesn't have to be a lot of questions to be effective. So definitely would recommend using the QBank longitudinal. There's another question here, and I think maybe this is something that Ken, you can take, Dr. Rubin, you can take for us. It said, I've just entered second year. Should I learn for the first 2 months and cover as many topics and then start the QBank, or use a QBank now itself, or can I use another QBank and then save UWorld for at last?
So it's a very reasonable question, and we know when we talk with students, especially when we work with Mount Sinai, we do intensive courses with them, and every year in the beginning of second year, I go and I talk with the students, and I try to get a feel for what they're doing. Many students will actually not use question banks so aggressively in the beginning of their years. They will focus more on the course itself, and then they'll really transition to QBank in the second half of the year. We still believe, just as we've been talking about throughout this hour, that using QBank early and often is the way to go. Because if you're whatever pathophysiology course you're in, whatever block or system you're doing, you want to really learn the material well. And there's no question that when you add high quality questions and explanations to the mix, which UWorld offers with the QBank, there's no question you're going to learn better doing that as opposed to somehow waiting. So again, as we had the slide about don't wait, don't save questions. This is a pathology that's very understandable, this kind of hoarding mentality, but actually counterproductive. And so we would recommend against saving the questions for later in the year. And in terms of using another QBank, this like the idea of a starter QBank, we've been dealing with this question for the last 10 years, since Dr. Bruschreimer and I have been doing this type of work. And whether it's RX or Kaplan or these other QBanks, there's always a sense of, well, if UWorld's the best QBank, I don't want to burn it, I want to save it. We didn't think that made sense when there were less than 2,000 questions in the QBank. We certainly don't think that makes sense now that there are about 4,000 questions in step one QBank. If you have a high quality resource, you want to use it early and often. And when you do use it early in second year, for example, there's a greater chance you will actually forget what the right answers are. So when you use it again in a more intensive way during dedicated for your second pass, you are not likely to remember the answers to most of those questions. So we would not deviate at all from the advice we've given. UWorld is great. There are other resources, other QBanks for supplementation if you want, but you're really going to get everything you need from the approach that we're recommending here.
Yeah. To summarize it with a food metaphor, I like UWorld should not be considered the dessert at the end. It should be considered the main course right away, and it's the focus of your learning. So that go with the high quality QBank right away and reuse that. Don't try to save it for later. I wanted to get to a question that came up through the chat. There was a question about using prepared flashcards for high yield topics, and there's a question: how do you do that? Because it takes time to prepare those questions, and whether you should use prepared ones or whether you should make your own flashcards. I can handle this, and maybe Ken, if you want to jump in as well. I think.
Not to interrupt at all, but we actually have an update on this on the UWorld site as well, because part of this question was, why is there not prepared flashcards for high yield topics in UWorld, and options for adding? So this is actually a subject that's been brought up pretty frequently over the last year. As more people, I think, are utilizing question banks to test prep. So it is something that we are working on our end, and we expect that to be a feature that's rolled out at some point in the next 12 months. Just to touch on that very part of that subject, that is something that we are currently working on at UWorld. But then, Marcel, if you wanted to take it a step further from there.
Yeah, totally. So I think what Kelly's pointing out, that's fantastic that they're going to have some prepared flashcards. But ultimately, what's important about a flashcard, and what I think I'm assuming the feature will allow you to do is that you also make personal edits to that flashcard and personal creation. The flashcards, the pre-prepped flashcards, the totally pre-made flashcards are oftentimes not perfectly suited to you. And so if at minimum, even if you have a flashcard that's pre-made, it's always good to be able to have an ability to edit and shrink it down to the information that's focused for you. When you make the flashcard from scratch and you follow the basic principles of keeping 5 or less pieces of information on there, it's going to naturally focus on your areas of need and your interests. Yes, it takes time, but we really do think there's, in general, greater value in flashcards that you have either edited or that you've created, and some combination of that. So it depends on the person. Okay. We don't have too much more time. We have only a couple more minutes. We have a couple more questions here. I guess wanted to go to a question I think that we didn't cover. It said, in the initial preparation phase, should I go with tutor mode or time mode? Dr. Rubin, do you want to?
Yeah, we strongly recommend tutor mode, and it can seem counterintuitive because so much of our emphasis with students is on test day preparation, building test taking skills. And of course, when you're taking UWorld for real at a prometric or at some other setting, you're doing a time. So students might think, oh, of course I should do everything time. But again, this goes back to this idea of the first versus the second pass. The first pass is all about learning, and tutor mode is ideal for that. When we ask our own tutors, our own high scoring tutors who have lots of experience themselves with their own exams and also working with students, pretty much across the board, everyone raves about tutor mode and loves that. You get a question, you're not sure, you get it wrong, you learn from the explanation, and then within the same set potentially later on, you can apply that knowledge to get the question right. That is the ideal sequence. If you do all timed mode, you might be getting the same question wrong again and again and again, and that's not great for learning. In the second pass, though, you want to be doing mostly time mode to simulate test day conditions.
That's great. I want to answer, this is probably our last question of the day, and I'll handle this one. It says, for the small group of students who don't do well with making notes or doing flashcards, making them, keeping up with them, etc., is only doing practice questions okay for step one study? Okay, so I think the bottom line answer to that question is yes, doing only the practice questions is okay, but I'll give you an example. So in clinical practice, oftentimes when you see patients may tend to say, oh, it hurts all over, or it's hurting here and here and here and here. And particularly you see this in children, right? You see it even with my own kids. So my kids come to me and they tell me they have pain somewhere, particularly pointing in their belly. I ask them to point with one finger, where does it hurt worst? And usually that helps to sort of localize their attention. Okay, it really hurts worst here. And then I can kind of say, okay, that's the point of pain. So I like to think of like, what is the one thing that's driving that medical diagnosis? So when students come to me and they ask me about what's the one thing I should be doing to study, and I think of it as I think of what's the one thing that's most important. And if we go back to that pyramid slide we showed at the beginning, that most important thing, if you could only do one thing to study, would be to do practice questions. Absolutely practice questions. If you could only choose one resource to work with to prepare for the exam, then it would be practice questions. So in short, the answer is yes. It can be okay just to do the practice questions. However, the broader perspective is good to have a mix of other things in there, but you definitely want to prioritize practice questions and high quality ones. And of course, UWorld offers that. So I think that's a sort of the short and long answers to that. Ken, I don't know if you want anything to add.
Yeah, I just want to say one thing on that. The point that Dr. Rushamer made before about editing flashcards, that idea is so essential. Whether it's making your own flashcards or editing someone else's flashcards or just having a Google document or a Word document or something, you want some scheme that's active. Unless you have a photographic memory where you read something or do a question and you just retain all of it, which is, some people have that. I don't have that. I don't think Dr. Rushamer has that. Very few of us actually have that. If we don't have that skill, then we need to find another way to make the information our own and retain it. And so you want to think about something active. It could even be in your mind, going over like, okay, let me go through the differential of chest pain. Can I name 5 systems or 7 systems and different diagnoses that the USMLE would test? You need some kind of active process. It could be in your mind. It could be writing out notes. It could be making flashcards. So although everyone is truly different, we would suggest that you think about some way, at least, to make your review process active and not just rely on passive imbibing of the information, and then somehow you'll be able to retain and express all of it on the exam.
Okay, great. I've answered one of the other questions that was open via text for those who are interested. And I think we're going to wrap up at this point. Thank you so much, everybody, for your attention. Kelly, I don't know if you have any last words before we wrap up here, but thank you for everybody who's paying attention. Join us via Zoom and also via live on YouTube.
Absolutely. No, I just wanted to, comment on a couple things. For those of you, again, who do not have UWorld yet, look in the next 48 hours. You will get an email from us. It will not come from my name. It'll come from UWorld, I believe UWorld support. And it would be for a new UWorld subscription only. But really just thank you so much for taking the time. And all of those questions were really great. And our whole motive behind the webinar was to help students get the most out of the question bank. And I hope that everybody found this very helpful.
Yeah, thank you, everybody. And we'll sign off here.
And thank you, Kelly and Courtney, again. This was great.